This is Iowa Talking Points, the candidates, produced by Studio 5 at Mud Advertising, Totally Iowa Media, and News Talk 1540 KXCL, where you hear from the candidates in contested races in the June 2026 Iowa primary election. Now, Iowa Talking Points, the candidates. From Studio 5 at Mud and Cedar Falls, here is Jeff Stein.
Hello and welcome. There will be a new member of Congress representing Northeast Iowa's 2nd District in Washington in January of 2027. It's an open seat due to the incumbent seeking other elective office. And there are 3 Democrats seeking their party's nomination to be on the November general election ballot. And one of those 3 joins us here today. She is Kathy Dolter, Democrat, running for House District number 2. DolterForCongress.org is the website. Thank you so much for taking the time.
Thank you so much for having me.
Talk a bit, if you would, please, about what led you to make a run for U.S. Congress.
So I think there's 2 reasons I'm running for Congress. The first is I'm a nurse and I just can't stand by and watch people suffer. And I think that currently the people of Iowa are suffering from the big bad bill. I call it the big bad bill, the Trump tariff taxes, and the cuts to federal programs. And then my number 2 reason is I took an oath. When I was 21 years old, I joined the Army. I was in Hanshaw Auditorium down in Iowa City, graduating from the University of Iowa, and I took an oath to protect and defend the Constitution of the United States against all enemies, foreign and domestic. And I'm a little bit worried that the President and our Congress aren't carrying out their congressional, and they're putting our Constitution at risk.
Well, thank you for your service. We will talk a bit more about how that led you along the trail as we continue this conversation. Let's talk some specifics about people being harmed as a result of that reconciliation bill being passed. Give us some examples of things that you have come across in your work or in your dealings with people that folks should know about.
I think the big thing on the bill is that it's cuts to Medicaid and SNAP, which hurt Iowa working families, the poor, the elderly in nursing home, and it's going to affect our rural and urban healthcare systems. So people always said it was going to just hurt our rural healthcare systems, but it's also hurting our urban healthcare systems. We've had Mercy One, which is a huge healthcare provider in the Northeast and across the state of Iowa, and they've laid off 67 in Des Moines and 34 in Mason City and 40 in Ottumwa. So, and they attribute that to the Medicaid, a lack of Medicaid reimbursement from the Medicaid cuts that we're experiencing. So then also the SNAP program's affected. Our schools are affected by the big bad bill cuts because that provides the services for counseling and mental health and school nurses and different therapists in our schools. So it causes a number of problems. And then for the nursing profession, one of the things it did is it affected students also for post-secondary schools. It affected tuition reimbursement or federal loan amounts. So there's professional loan amounts and non-professional loan amounts, and it decreased the amount that students can borrow, such as medical students, when the prices are going up all the time. So it decreased the caps on those federal loans, and then it reclassified nursing and social work as non-professions. So now that decreases the amount because professional loans, there's a higher cap and there's a lower cap for non-professionals. So it's affected a lot. And I'm worried about that. And
I asked the question the way I did because a lot of people talk broadly, and I wanted to make sure that you had the opportunity to give some of those specifics because, again, it's easy to talk in a broad phrase. The rural health situation, because of your career in nursing and nursing education, you have some unique perspective. Mm-hmm. Help us understand broadly, and I have heard from all sorts of folks about the reimbursement issue, but why is there such a crisis in rural health care in our state or the country? How did we get to that point?
I think that a lot of the people in the rural areas they need Medicaid. They have a high percentage of Medicaid patients.
Sure.
And so any healthcare system will with a high percentage of Medicaid is going to be hurt more. So I was on the Finley Hospital Board of Directors in Dubuque at one time, and that's they didn't have a high percentage of Medicaid. I mean, that's a big city with lots of employers, but yet when you look at the revenue coming in, about 50% was Medicare and Medicaid. And so if you have even our urban healthcare systems, if you lose like a third or 25 to 33% of your revenue, right, you're going to be hurt. Just like we had Mercy One in Clinton just closed its labor and delivery services. So our rural healthcare systems are already on edge. They don't get the appropriate amount. I think you need to subsidize them more. Supposedly in the big bad bill, they were supposed to be given $50 billion to help level off the Medicaid cuts, and that is not going to help them. When you talk to and listen to rural healthcare administrators, that is not going to be enough to shore up all the losses they have from Medicaid.
So as a member of Congress from Northeast Iowa, what can you do in the next session of Congress to remedy some of these things?
I would make sure we repeal the big bill, right? The big bill. And then I think what we need to do is increase Medicaid reimbursement rates, because we've got 40% of our children in Iowa are on Medicaid. I think that it's a large number of our population, and we want to make sure there's so many providers who don't even take Medicaid. They will not even take it. So patients cannot get care because providers don't. So dentists
and why don't they? Just explain so that we all understand.
Because the reimbursement per dollar is so low, is the lowest for Medicaid. And so that is why. And so you have to increase that Medicaid reimbursement. But I'm really a champion for universal health care, because the United States has the worst healthcare system among all the developed nations, right? We pay 2 to 3 times more per person than any other developed comparable nation, and we have the worst outcomes. So we have the shortest length of life for men, the shortest length of life for women, the highest infant mortality rate, the highest maternal mortality rate, and we live in the green zone, what I call the green zone, without meds. From when we're born until we start getting chronic diseases, we live the shortest time in the green zone than any other country. So we're not getting what we pay for. And people can't afford their health care anymore because the high deductibles, 10 and 20 grand. So it's like we can't afford it. Something's wrong. It's really broken. American Hospital Association says that 40% of the cost of our health care is really just administrative paperwork. And I think the Iowa Medical Society says for every 30 minutes they spend with a patient, they spend 45 minutes on paperwork. And it's all that denials. You have insurance, but they deny your care, and then the providers have to spend all the time getting authorization to do it. After it's denied, they have to call back and prove their case. No, you can't deny this. This person really needs this care. And so I think there's a lot of things wrong with our American healthcare system, and we're living in a dream that we really sometimes I'd consider us almost a second world healthcare system comparatively to the other countries, comparable rich nations in the world.
Now, obviously, if there's not enough government funding for something like Medicaid, you could put more funding toward it, but we already are at a $39 trillion debt that's going to be 40 before the general election if current standards hold true. So where do we find the money for that? I assume there are some places where you think there's spending being made that could be redirected at the very least.
Right. Well, if you get rid of all these administrative costs, right, it's 33% is Medicare, Medicaid overhead. You stop shuffling the paperwork. You don't have to have as many people in the back office doing administrative paperwork. You have more, maybe then decrease that cost would be incredible. But the focus on prevention, we need to prevent things. So like the number one most expensive thing in the hospital is a premature baby, right, in the neonatal ICU. It's one of the most expensive things. And so if we gave good prenatal care, made sure if we all had universal health care, we'd make sure the moms were healthy prior to getting pregnant so that they could then keep the baby in the oven for 9 months, and then we'd have healthier babies and cut that cost. Another reason is falls, right? We have all these falls in elderly that cause elderly to break their hips, cause head injuries, but even just the hip fracture. Usually people have a hip fracture after they fall, right? And then it's really poor prognosis. Usually people die within the first year after a hip fracture. I mean, in the past. And so what we could do is prevent falls. There's evidence-based Tai Chi, fall prevention, balancing exercises to prevent. So we could focus so much on prevention, and we would save a lot of money with focusing on prevention, plus getting rid of the administrative costs. And then I think our employers would benefit, right? Because they would be more competitive with other corporations around the world, because they would no longer have to provide health care for their employees. And right now they muck about with the 32 hours to the 40 hours, right? And they do all sorts of things to keep people less than 32 hours so they don't have to provide insurance. And so employers would get out of that game. They wouldn't have to worry about it. They could, employees could work 40 hours, and employers could have them work 40 hours, and they could get the benefit of full-time employees.
And again, with the private system, there are not that many policies, I would suggest, that encourage wellness and a preventive test. And so they throw up an impediment to a very simple little screening or a test or some procedure that could telegraph a problem well before it became a more serious health problem, but also much more expensive.
Yes, and that's the whole thing about early screening and early diagnosis, so you can intervene prior to it getting worse, especially with cancers and many other illnesses. But I think that there's so much. And then when you look at what's really happening right now is a lot of our employers are taking advantage of us taxpayers, because of many of their employees they don't get them to the 32 hours a week. So they work for that big employer. They keep them under 32 hours, and they need Medicaid. So the biggest employers among them are Walmart and Amazon and Casey's and McDonald's. And it's like, so we're really paying for these employers not providing health care. And we're supposed to have an employer-based healthcare system, but we don't.
And because they're playing that game of the hours, it then puts a greater burden on Medicaid and related systems.
Right. So, yeah. So if we were all level playing field, I think and I worked in 2 national healthcare systems, right? The VA, I worked in the VA in the central office, and after I retired, but I was in the Department of Defense. And that's a national healthcare system, as is the Indian healthcare system. And it provides very good care and high quality care. And I worked civilian healthcare and military healthcare, and I thought the higher quality was in the military.
Kathy Dolter is a Democrat running for U.S. House from District Number 2, that's Northeast Iowa. DolterForCongress.org is the website. We'll continue with this conversation in a moment. You're watching Iowa Talking Points, the candidates.
All the great news talk programs you love from KXEL on your radio can be with you wherever you go.
I'm Todd Starnes.
This is Mark Levin.
I'm Tim Harwood.
Bill O'Reilly here.
I'm Kim Commando.
Hey, it's Glenn Beck.
I'm Jeff Stein.
Just download the free KXEL mobile app. You can find us in the App Store or Google Play. Make sure you never miss a second of the conversation. Download the KXEL app today. It's a great way to stay connected to where Iowa comes to talk.
One opportunity. Change your career. Mudd Advertising is hiring product specialists. $20 an hour, paid weekly. That's 52 weeks a year, plus record-breaking profit sharing. Let me repeat, $20 an hour plus record-breaking profit sharing. But we're just getting started. The best in the business, 401k, company match, gold standard health plans, on-site fitness center, generous paid time off, and so much more. Apply today and don't look back.
You're watching Iowa Talking Points, the candidates. Here again is Jeff Stein.
And we are speaking in this edition of the program to Kathy Dolter. She is a Democrat running for the U.S. House, District 2, Northeast Iowa. DolterForCongress.org is the website. I'd like to know a bit more about your background. You mentioned your military service. Tell us about what led you to join the military, become a nurse, and become a nursing educator.
Well, I think I always wanted to be a nurse, and I actually wanted to be a doctor. And I started working at a nursing home for the Sisters of Mercy on the Loris campus in Dubuque. And it was the only job I could get. It was during the recession, right? And so I said, I wanted to really work at the mall or Burger King, but then only job I could find. But I grew to love taking care of the nuns and enjoyed that so much. But I was like a pre-med chem major at Loris. And then I switched my major to pre-nursing, and then I transferred to the University of Iowa where I graduated. So yeah. And then I think I joined the Army because I broke up with some guy. I think all the things, sometimes you make decisions and it's like, well, that was a positive decision. I said,
It turned out well.
I turned out well. So I joined the Army Nurse Corps, and then I was stationed, asked for Walter Reed, served one tour there, and then I wanted to see I missed my family. I wanted to come back to Iowa. So I worked at the University of Iowa, hospitals and clinics, in their medical ICU and their surgical ICU and Mercy Hospital. And then I said, I like Army nursing better. I can outrank doctors there and stuff. So went back into the Army Nurse Corps. And then you have progression of leadership, right? Staff nurse, charge nurse. I was a nurse manager at a neurotrauma unit at a level 1 trauma center in San Antonio. Taught the Army's critical care course, chief of education at Blancheville Regional Medical Center. And then I got the best job. One of the best jobs I've ever had is the Army Surgeon General picked me to come out of Europe and lead and start his evidence-based clinical practice guideline project. He had 4 Ps that he wanted to do: practice guidelines, prevention, and population health, and I think productivity. And so I had one of his Ps. And so I started from scratch the VA DOD evidence-based clinical practice guideline project, which was designed. I didn't even know what a clinical practice guideline was. And he wanted 12 of them. I got there in March, and he wanted 12 of them by July. And I said, sir, I had to tell him when I found it out, nope, can't do it by 12. Send her back. He wanted me to be sent back. It's like, why did we get her out of there? But then he grew to really respect my work, and we developed 12 clinical practice guidelines: PTSD, substance use, depression, obesity, diabetes, COPD. But you bring providers from all over the VA and Department of Defense, Army, Navy, Air Force, VA, and they look at all the research, what is on each, like such as low back pain, and then they put together answer questions, get all the research, and they look at it and they define what is the best practice. And so then we worked with RAND Corporation and we developed toolkits, and then we did a kickoff from the Food and Drug Administration studio in DC, and we had metrics to measure how we were doing. But how do you really treat? By the evidence, so that you ensure the quality of care. And so we did that for 12 of them. And then I also did that. Then I got out of the Army and retired because I wanted to come home and be by my family. Started, taught at the University of Iowa, started a nursing, was recruited because I was an Army nurse to start a nursing program at University of Dubuque from scratch. And then worked for the National Council for State Boards of Nursing, which is a regulatory agency over all the boards of nursing in the country. And then worked at the VA central office in D.C. and made sure they did a suicide prevention guideline for our soldiers and sailors, airmen, Marines who had been in Iraq and Iran and were suffering from that. They didn't want to do it, but I controlled the agenda, so I got that one in, and that one was passed. And then I started a graduate program at Mount Mercy because I wanted to be back in Iowa. If I'm not doing something for the military or the Department of Defense or VA, I'm in Iowa. Started that program. I was just finishing it up, got it accredited and approved, and then I was Dean of Nursing at Kirkwood for 10 years. So I've got lots of healthcare experience and lots of education experience. And then I'm also a public servant. So chair of the Dubuque County Board of Health right now. Served on the Iowa Board of Nursing for 6 years. Been the Hospital Board of Directors. And I'm currently on the Dubuque Board of Hospice. Hospice board. So and then I was the National League of Nursing, worked with for accreditation, part of their accreditation program review committee. So volunteer a lot. So I know education, I know the military, and know healthcare. So
one of the things that is very helpful for someone in elective office, particularly a legislature, whether it's at the state level or Congress, is the ability to A, get things done, but B, in order to do that, you have to work with others. And it sounds like you've had a fair amount of experience in coalition building, in strategizing, in making your case, because again, 25 years that I spent in education at the college level, you don't just start a program from scratch.
No.
It's not an easy lift. Talk a bit, if you would, about your skill set with regard to being able to marshal evidence, get some people together, and take it across the finish line, and how that would be helpful in Washington.
Yeah, so like with the VA DOD, it was me, myself, and I at the U.S. Army Medical Command in San Antonio, and then I had to get the budget, and it was only $1 million. Then they gave me some people, and then I had to go find the person in the VA I needed to work with. Then I had to go find the person in the Navy and the Air Force that I needed to work with, and then we started meeting regularly. We figured out who had the resources, and then I had to find more money. So the only way, there's no more money, right, in the government, but you can build coalitions. So you get the Pharmacoeconomic Center, Department of Defense to work with you, or you get the Center for Health Promotion and Preventive Medicine to bring money to the table. And the VA had the deep pockets, and we partnered with them. And then there was another place working that had the RAND contract that we worked with. So it was working together. And then every guideline we brought different groups of providers who were experts. The VA brought the specialty experts, and the Department of Defense brought the primary care experts. But it was always coalition building. And then when we wanted to do it, like my one boss didn't want to do it. I said, well, excuse me, sir, but this 3-star says we need to do it. And then I had to tell the 3-star, well, I knew his aide because we had shared an office in Germany. And I said, this guy doesn't want to play ball. And then we were moved out from under him. So, but then I started the nursing program Dubuque. The other nursing programs didn't want that. But so where do we go? If we don't touch your day shifts, then clinical for day shifts, then we'll go in the evening shifts. So it's working around and working with and finding out, going around obstacles, working with people. But if you have to go around people, you'll go around people. But every time you have a mission in the Army, right, you have 2 to 3 years to get it done. You make it happen and you move on. So I'm not a homesteader. I'm a doer. I'm an innovator, and I can work with people, and even faculty. You were a faculty, right? So even faculty.
That's not easy, is
it? and faculty, it's like, so I wanted to implement Nursing Central, which took 5 books, put them on an app that would be so nice for the students, right, to be able to access, and they wouldn't break their backs carrying all those books around. Took 2 years to convince the faculty that we'd used it in another program, and then finally somebody said, well, she'll just keep on asking us. But I didn't. I listened to the faculty, right? I I never overruled them. It's their curriculum and it's their decision. But I kept on asking them, and then they finally said, she's going to keep on asking us. And then they liked it when we did it. So I think it's really important. It is really, it's all about working with people together, and some people may not like what you're asking them to do, and then, but how can we make it happen?
Kathy Dolter is our guest. She is a Democrat running for Congress from Northeast Iowa's 2nd District. More with her in a moment as Iowa Talking Points, the candidates, continues.
one opportunity. Change your career. Mud Advertising is hiring product specialists. $20 an hour, paid weekly. That's 52 weeks a year, plus record-breaking profit sharing. Let me repeat, $20 an hour plus record-breaking profit sharing. But we're just getting started. The best in the business, 401k, company match, gold standard health plans, on-site fitness center, generous paid time off, and so much more. Apply today and don't look back.
Watch all the programs in the Iowa Talking Points series online at iowatalkingpoints.com. Iowa Talking Points, the candidates, continues with Jeff Stein.
And we continue our conversation with Kathy Dolter. She is a Democrat running for Congress from Northeast Iowa's 2nd Congressional District. Online, it's dolterforcongress.org. You retired with the rank of Lieutenant Colonel, as I recall, and then, again, the educational experiences you mentioned. So you are one of 3 running for the Democratic nomination in the June primary. Distinguish yourself from the other candidates so that as someone who's going to participate in the process is trying to decide which they should vote for, what separates you from the others?
I think the big thing is my experience. I don't need anybody to hand me a briefing paper on what's going on in healthcare, on what I need to think about healthcare, or what my key points are on education, or what my key points are on the military, or what I should think, right? I've lived it, so I know it, and I've kept up with it. And so I think that is. Now, I've got 2 wonderful opponents, but they don't have that type of experience. And I think that Pastor Clint Tweed Ball is out of Cedar Rapids, and he's had leadership and management experience in the establishment of Matthew 25 and has a lot of experience in that area. And then Representative Lindsey James, House Representative Lindsey James, she's got the political experience, and she's got and was a hospital chaplain. But I have a more wider and a breadth of experience, plus a little bit of seasoning. I've been around the block a few times, lots of management and other experience, and working and managing teams of people to get things done. And I think and diverse groups of people. So I think that's what sets me apart.
It helps, I think, for voters to know a bit about the philosophical bent of an individual, because I could ask you about 6 very contemporary issues before Congress, and none of the 6 might be relevant by the time you would take office, but we would get a little guide as to how you might proceed or how you might view a certain issue based upon a broader framework of the role of government. Give us a sense, if you will, of as you look at what the federal government, because you're running for Congress, what the federal government should be doing.
Well, I think the federal government needs to do what's in the Constitution. So the Article 1 powers, so declaration of war is a power that's Congress's. And I don't think that we should allow presidents to declare war or get us into conflicts. I think that Congress also has the power of oversight because they have the power of the purse. So they give this money out. And so the money, when it's given away, that needs to be, they need to the military, the Department of Defense, or to the Department of Homeland Security, or the Department of Health and Human Services. What we have to do is make sure that that money that was appropriate is actually used for the purpose that we gave it. And right now that's not happening. That was to fund lots of people and staff at those agencies, and DOJ came along and took all those people away. Those are providing services. Department of Education is appropriated and was established by Congress, and now it is being torn apart. So there's things so that's Congress's job. They decided this is supposed to be there. They gave the money, and then it should be spent. And there should be metrics, right? There should be metrics to make sure we're spending it wisely and there's no fraud, waste, and abuse. But I don't see Congress doing its power of the purse, the declaration of war, and they're not doing oversight. And I don't think I've worked for lots of different things, and you have metrics. You have outcomes. You have to say, how much money are we spending in this, and what are we getting for what we're doing, right? And so I think that's part of it, too. So I think Congress currently is not doing its job And I think that's where a lot of the problems are coming. I think presidents, even before Trump, there's been abuse of executive orders and presidential pardons and declarations of war and declaration of emergency. And that's because of inaction. Part of it's by overreach by presidents, and part of it's by Congress not doing its job. So I think we need to get back to Article 1 means Congress is number one, Article 2 is presidency, so that's the president's number 2. But everybody needs to stay in their lane. When the Supreme Court, Neil Gorsuch says on the I think it was the tariff decision, he said that Congress, you're not doing your job. Get a grip. So the tariff powers are part of Congress's job. So we've got problems because we've got Congress not doing their job and president not staying in the lane. And that's not just this president. There's been overreach by previous presidents.
And I think that's an interesting point because I've talked with elected officials on both sides of the political aisle over a period of time. Mm-hmm. And many of them, even those who have been in Congress during this period of time, have said Congress is not fully doing what the Constitution provided. For example, they may pass a law and then abdicate the specifics, the rules, to an executive branch or to an office that they've established within the executive branch, and you have no direct accountability because you've got this whole bureaucracy, call it what you will, who are trying to interpret Congress's intent because Congress wasn't specific enough because it was easier just to pass a broad statement.
And then I think they're not doing their job. I think there's too much money in politics. And so they say that they only spend, what the estimate is that Congress people now only spend a third of their time actually working for us, the voters, because they're spending 2/3 of their time dialing for dollars and making money for their next run. And then also, with all this money, who are they bought and paid for by? If you get last Illinois, I think it was the Illinois primary, $15 million or something, and we had billionaires throwing in, and AI and crypto and Israel, APEC, and it's like, well, then who do you belong to if all this money got you to where you are? And so I think that's problematic. But they're also on social media and they're doing performance. They're always doing performative things instead of focusing on their role in Congress. So I think Congress is broken and money has contributed a lot of it, and I think we need to have some campaign finance reform. I don't think corporations are people too. So
Kathy Dolter is our guest. She is a Democrat running for U.S. Congress from the 2nd Congressional District. You find more online at dolterforcongress.org. Our final segment in a moment as Iowa Talking Points, the candidates, continues. Iowa has a wonderful heritage, and each day I'll share these stories of historic people and events with you. I'm Jeff Stein. Join me for the Iowa Almanac program and learn more about this great place we call home. Now 7 days a week. Listen on radio stations across the state, via podcast, or at iowaalmanac.com.
One opportunity. Change your career. Mud Advertising is hiring product specialists. $20 an hour, paid weekly. That's 52 weeks a year plus record-breaking profit sharing. Let me repeat, $20 an hour plus record-breaking profit sharing. But we're just getting started. The best in the business, 401k, company match, gold standard health plans, on-site fitness center, generous paid time off, and so much more. Apply today and don't look back.
You're watching Iowa Talking Points, the candidates. Here again is Jeff Stein.
A few more minutes with Kathy Dolter. She is a Democrat running for the U.S. House. That's Northeast Iowa's District Number 2, online, dolterforcongress.org. We talked in the last segment about what's necessary to run a campaign and to stay in office. Lots of money, lots of fundraising, etc. Share, if you would, some of the challenges of running a campaign. Now, again, this is an open seat, so there's not an incumbent.
Right.
But you've got to win a primary, and you have not been part of the political system before, as in at the State House, and now you're trying for this. So you're coming at it from a different perspective. I'm just wondering what some of the challenges are.
Well, I think a lot of it, I would say the challenge is that it's all about the money, and it's not about the voter, and it's not about the people. So I was asked early on, and so I'm a definite long shot. I'm the long shot. That's it. And the big thing is, my campaign manager would say, you need to call people every day. You need to be on the phone 8 to 10 hours a day, and you need to call people, and you need to ask them for money. And I said, the only people, nobody answers their phone, right? And the only people who do answer the phone are really older people, and they might be a little lonely. And then I'm calling them and asking them for money, and then they've got to send them a text and they click this link. And I said, those are the things I told my mom not to do. Don't answer the phone and don't click the link. So I was like, I'm not comfortable with this. I'm not going to do it. You can, and so I don't. I just go, I have events, I talk to people, I'm making it about votes, pie in the sky, right? Pie in the sky. But if you take the money, then who are you? You're just part of the problem. So I have a lot of people who like me, right? And I know a lot of people. Well, I think I know all the nurses in Northeast Iowa. Well, around Cedar Rapids, right? I had 1,500 of them graduate, and then all their families, and know all that. So, no, I'm a long shot, but I'm just not going to participate in the nastiness and the craziness. So I participate in all the IDP events and all the events, and then have events of my own. When I have events, I invite the House and Senate, Iowa House and Senate newbies who are coming up, right, and need some forums, and we do things together. So we kind of look like a team, and they get a chance to speak too, and we all get to do that. So no, I'm a definite outsider in this political process. I think it's really stupid. Well, it asks you to spend a lot of money on stuff that people don't like. We're asking them to send them emails and click on links. Spam, nope. Does that sound like a smart thing to do? Then I was told, iHeartRadio, and let's do that. And it's like nothing. It's like, so I don't know. It's just a very interesting, and then very interesting process. So I just want to be proud of myself when I get done with it, and be able to live with myself after I'm done with it.
Well, and given the fact, and I'll only take exception with your use of the phrase long shot, is that we have no idea what voters are going to do on June 2nd. And this is not the kind of race that has a lot of very deep public polling. So I think everyone is as long or short a shot as anyone else. What have you learned about yourself during this opportunity? Because I know you may learn about the voters, you may learn what interests them, but I find that often a candidate learns something about himself or herself during the process, whether it's the meetings, the long drives in the car from home to a TV studio, etc. So as you have a quiet moment and think, what have you learned about yourself?
I've learned that even though I thought I was really well informed, there is so much still to learn about every issue, right? There's so many different versions, and so I'm an evidence-based person. So I'm not just going to this is what I think now, but I'm going to be informed by others' viewpoints and their lived experience, but also the data and the research. Because and I think that it's just so amazing how much we don't know, and that we all are in our own little silos, and we think we know the answers, right? And we're in our own little and echo chambers, right? Because we only talk to people who agree with us, or we don't. I've got family members who are Republicans, then we don't talk at all. So then we don't talk at all, and then we've got the echo chamber of all the people who agree with you. But there's so many different viewpoints, and then I've learned a lot about the people of Iowa too, traveling around the 2nd District, and before they would be able to tell me an issue that was bothering, like their top issue. I always ask people what their top issue is, and they'd say the environment or Social Security or healthcare or immigration. And then now they just say everything. They can't even come up with one issue. But the one thing that they usually say is, I'm worried about the legacy that we're leaving our children, the country, right? And that they don't like the discord. You know, we didn't have this. When I was young, we didn't have this. People could talk about politics and still be friends. And it wasn't like existential crisis if you voted, you voted for a Republican, or I have voted for Republicans in the past. I was an independent, right? I always wanted to vote for the best person. So, yep, I'm going to say may the best person win.
Well, you are asking Iowa Democrats in the 2nd District to choose you as the best person in the June primary. So in our remaining couple of minutes, I'll let you address those voters directly to tell them why they should vote for you to be their nominee for Congress.
So because I'm an American, an Iowan, a veteran, a nurse, an educator, a public servant, and I can get things done. I've gotten things done all my life. Every job I've ever had, I was the most qualified for. I think the other thing is I already have a plan. I say we all need to be alive, so we all need to have health care, be healthy and have health care. And then B, bucks, we all need to have sufficient bucks to buy food, shelter, and electricity for ourselves and our families. And C, I think we all need to have our constitutional freedoms to be able to be free to live, love, laugh, speak, assemble, and have due process. Because if we're alive and have bucks but aren't free, what's the point? And then I think the other thing is if one of us is not free, then all of us are at risk of not being free. So we all have to be careful of each other's freedoms. So that's why. And go to my website, and under ABC, and there's a DEF, and I'll still be adding to it. I have what I believe under each of those points. So I'm sincere, I'm a hard worker, very passionate. I'm known for being passionate, qualified, and getting things done. So I would do that for the people of the 2nd District. And I wouldn't be working for anybody with a corporate background and corporate lobbyists. I've been there. I don't need that, right? So I've got a great Army retirement, and I'm good to go. So I don't need any money and don't want to homestead. But I want to make change happen because I've got nieces. I'm single, but I've got nieces and nephews, and I got a lot of students, former students, that we want to take care of. So thank you so much.
Thank you. And that website, where every letter has a meaning as you add to it, is dolterforcongress.org. Kathy Dolter, Democrat running for U.S. House in the 2nd District. Thank you for the time, and good luck in the race.
Thank you so very much.
All right.
Thank you.
And that brings us to the close of this edition of Iowa Talking Points, the candidates.
This has been Iowa Talking Points, the candidates, produced by Studio 5 at Mud Advertising, Totally Iowa Media, and News Talk 1540 KXCL. For more information on this series, go to iowatalkingpoints.com.